pediatric nursing research presentation. First presentation will be presented by Professor Iqbal Ghunim Maalla. Not found. The second one, Dr. Sana Ahmed. Her presentation about obesity among school-aged children risk factors.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. We will start our talk about obesity among school-aged children, risk factors. Childhood obesity is now one of the most significant public health challenges of 21st century nationally and internationally, with prevalence rate tripling over the past 15 years. Childhood obesity refers to children and youth between the ages in between 2 and 18 years who suffer from an excess of body fat reflecting through body mass index. Unfortunately, childhood obesity has become a major health problem and a worldwide epidemic. National Health and Nutritional Examination Survey indicated that prevalence of obesity is increasing in all pediatric age group in both sexes. And according to the International Obesity Task Force, at least 155 million in the worldwide children aged in between 5 and 17 are obese. Globally, it was estimated that childhood obesity is affecting about 1 in every 10 child worldwide. And several studies suggested that school age are potential setting to target both children and the adolescents population for obesity prevention, so that identifying risk factors of obesity in school-age children would help us to develop appropriate intervention to reduce the future burden of obesity as a problem among children in Egypt. Risk factors of childhood obesity are genetic factors, environmental factors, lifestyle preferences, and the cultural environment seems to play major roles in raising prevalence of obesity worldwide. Consequently, risk factors of obesity can be one or more factors. One of the major environmental factors that contribute to obesity is diet intake. So physical, psychological, and social health problems are caused due to childhood obesity. Finally, research studies suggested that lack of physical activities, low parental education, family history of obesity, and spending time on sedentary activities such as watching TV and playing video games are risk factors of obesity in children. The aim of the study was to assess risk factors of obesity among school-aged children. It was noted that childhood obesity is one of the major health problems, as we said in the background, and there are limited researches concerning risk factors, especially in those age group, I mean school-age children. And once childhood obesity is a particular public health concern in Egypt, because children have a higher risk for diseases and increased risk for mortality and morbidity with obesity associated with chronic disease, which are already a burden to the struggling health system in Egypt. Cross-sectional study research design was established to perform the study. Random sample of 125 primary school age obese children were participated in the study. The study was conducted in the 2 governmental primary schools at Giza City. Our inclusion and exclusion criteria: obese children below 6 and above 12 years were included, but we excluded the more than 6 years and less than 6 years and more than 12 years. And also excluded chronic illness condition in children, and also children have chromosomal defects. We take permission from the heads of educational directorate. Then the researcher visited the chosen schools to perform the research study, and we get also verbal informed consent. We have 3 tools in this studies. The first one, anthropometric measurements, include weight, height, and body mass index. Body mass index calculated by dividing weight in kilogram by square height in meter. A questionnaire sheet includes socio-demographic data and data to assess children and their parents. The third one, self-administered questionnaire sheet, which provide and clarified for those children to be answered, and includes personal data as well as questions related to lifestyle, eating habits, sleeping pattern, and also school questions related to engagement of their activities. The results: first one, regarding socio-demographic data for children, we found that 58% from those children were females, and they ranked approximately 52% ranked third or more. In relation to characteristics of the mothers, 42.4% cannot read and write, and also we found 61% housewife. In relation to mean anthropometric measurements for those children, the mean weight were 46.3, and the mean height were approximately 159, and the body mass index was 31.5. It was clear from this table that almost of children, approximately 58%, were female. It means that I think 72 children or school-age children exactly out of 125. And it was clear also from this table that 22% from those children in grade 3 in between 8 and 9 years. Frequency of risk factors for obesity among school-age children: 43% eating fast foods meals more than twice weekly, and approximately 46% from those children love sweets and chocolates, love carbonated drinks, and also drinking juice more than twice per week. In relation to sedentary activity, we found that 44% from those children watching TV in between 3 to 4 times daily, and 46.4 also had one parent obese, while 35% from those children, no one from their parents were obese. Maybe this is attributed to other risk factors as increasing sedentary activities or decreased physical activities. Activities related to risk factors for obesity among study sample, we found that also 62% had not achieved or performing physical activities at home, and the majority of them also not achieving any physical activities at school. 58% from those children has more than 4 hours daily activities for sedentary activities, exactly as computer game or video game. Regarding transportation to school, 45.6% go to school by bus, while 25.6% go to school walking. The final risk factors in relation to sleeping time per day, we found that 51% had more or spending more than 8 hours per day plus equal or more than 2 hours for nap, sleeping time daily. We concluded that the rate of obesity was highest at the age of in between 8 to 9 years or grade 3 and increased with the rise in age. Also, the study indicated that several risk factors as limited physical activities, more sleeping time daily, imperfect eating habits, and high level of sedentary activities has or were significantly high among school-aged children in Giza. Finally, the research study emphasized that the true, which identifying risk factors for obesity in school-aged children would help to develop appropriate intervention for reducing future burden of childhood obesity in Egypt. Finally, we recommended that improving the healthy diets in the primary school-aged children to reduce risk factors of obesity by implementing comprehensive healthy lifestyle programs and future programs for parents of school-age obese children in relation to raising their awareness and assure better quality of care related to childhood obesity. And finally, performing physical activities where improve also health and reduce risk factors of obesity in children. And thank you.
Thank you, Dr. Sana. Any question from Dr. Sana? Okay, you can start.
I want to ask Dr. Sana about the significance of this study. And another question about the sampling procedure.
The sampling procedure. The first questions,
Significance of the study.
I spoke about the significance of study. You need to see again?
Clarification was there is statistics about the obesity in children.
Yes, we have more statistics regarding Dr. Nagla is asking about significance. You have two questions. The first one about significance of the study. The second one in relation to sampling procedure. Okay. Yeah. In regarding the first questions, significance of this study, we have more statistics, but the time now is not enough to explain it. I mean, I read more review and more researches about this problem, I mean childhood obesity, but we find that it is a shortage regarding to school-age children, especially have obesity or obese childhood in this age exactly, I mean school age. This is in relation to significance of the study. So we find we have to, and also risk factors of this age group. So we find we have to more research, to do more research related to this age group and obesity as a burden problem in Egypt. Okay. The second question you asked me about the procedures. Sample procedures. In the schools, we did the study in the schools, the primary schools, and we take permission, as we said. The procedure I did, actually, or I measure weight, with height, with body mass index. ما أنا هقول أهو. Okay. Okay. So after I measuring the weight, height, and the body mass index, and take the tools also and write it, we select the samples. according to the body mass index of them. First, I asked the directorate and the teachers about the obese children. I'm the one who select the cases because I'm looking for the obese children exactly. Okay? Thank you.
Another question? Okay.
Convenient sample أنا قلتها. I said that, Dr. Hannah. I explained this. This is convenient samples, Dr. Hannah.
Any other question? Okay. Thank you for Dr. Sana. The second session. Few minutes. Wait for
Samira, can you hear me? Hello, Samira?
Yes, Zainab.
Okay. Hello, Dr. Frigari.
But I cannot hear you clearly. My voice is coming on twice.
Okay, this is the time for Dr. Frigari to present her talk.
I can hear the echo of my voice. Zainab, I can hear you now.
Okay. So you can hear me clearly now?
Yeah, but there's an echo
Okay.
when I talk.
Okay, hold on. You can hear me clearly now?
Zainab?
You can hear me now?
See. Okay, you will be hearing me twice.
Okay, we can hear you clearly. Can Dr. Frigari start? The audience are waiting.
I don't understand what you say.
I'm just saying, can you hear me now?
I do not hear you clearly. You know what, Zainab?
Can you
I
start?
can hear you better. Zainab, I can hear you better without the microphone.
Okay, you can hear me now? Okay, I just want Dr. Frigari to start her presentation.
Oh, start the presentation. Okay.
Start.
Okay, Dr. Gary. Okay. Give her this, the click. Give her the click. And give them brief the production. Now. Good afternoon, my colleagues in Egypt. I'm Faye Gary. I'm a professor here at the Golden School of Nursing. My background is psychiatric and mental health nursing with a heavy focus on children, families, and communities. I've had extensive experience in working in international communities and the World Health Organization has been in primary health care programs in under-resourced nations. I'm also a colleague, and I've had the opportunity to work with my colleagues and I still miss her every day and wish to say a special hello to her. I've been asked to talk about specialties in community nursing. I've developed two basic objectives, and I wish to tie them together as we talk about specific health problems in Egypt that mirror some of the same health problems here in the United States and across the world. I wish to discuss the impact of community needs in nursing and in health, and to recognize the overlap between specialties in community nursing and community needs, and the many challenges and opportunities that exist for nurses. Again, I'd like to emphasize that some of the same problems and issues that we confront and are challenged with in Egypt exist right here in Cleveland, Ohio, other places in the United States, and throughout the world. Oh, it's not. Click on the other one. First, I'd like to begin by providing some basic kinds of models or frames of reference for discussing community health, the needs of individuals in families and in communities. The models that I have chosen are models that have been considered to be culturally relevant and useful in most communities in the world. And as I quickly go through them, I think you will understand that they can be adapted for any community. I'm going to start at the bottom, but I could very well start here at the top. And I want you to recognize that I'm talking about the life course, from conception all the way to death. And I wish to emphasize that the environment is significant. We know that people who live in rural communities, for an example, have some of the same challenges, but also different challenges than people who live in urban areas. Now, if we look at this model and start here, we'll see that individuals comprise population health. So individuals must be healthy before we can state that communities are healthy or that certain populations are healthy. Now, what makes healthy populations? We have to be clear about the pathophysiological pathways that exist in environments and among people that might generate disease and certain kinds of frailties and disabilities for individuals. We also have to consider the genetic and constitutional factors, because we do know that certain illnesses such as diabetes or mental illness or depression, alcoholism can find their pathways through genetic and constitutional structures of parents of children. We can never, ever underestimate individual risk that would also include one's own health behaviors, one's own health beliefs, and one's own health practices. Throughout the world, we know that social relationships are important to the maintenance of health. We know this from infancy all the way up until the time of death, that social relationships help to sustain us as human beings. It helps us to reduce stress. It helps us to have goals and objectives in our lives. And it helps us to realize our dreams and to be productive